The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. We are going to start in just a few minutes, in about 3 to 4 minutes. Thanks. All right, let's go ahead and get started. Good morning, everyone. Thank you for joining us on this wonderful Tuesday morning for this month's advocacy webinar. Once again, my name is JP Dorval, the Advocacy and Public Policy Liaison for Prevention Action Alliance. And today we also have a special session of the advocacy webinar. Today we have a special guest who I'm sure you all can see on your screen because he is sharing his video feed with us, which is awesome. Kevin Lorsen, Dr. Kevin Lorsen. Can I call you Doctor Kevin? Because you have a PhD, correct?
Correct, but Kevin is fine. I'm
Uh,
not that formal, and many people have told me you're not a real doctor. So,
well, I
um,
think you're a doctor regardless. But Kevin today is going to help us navigate and understand something called the whole child framework, and this is something that has been underway for quite some time now that the state's been working on with partners throughout the state, and really will help give us a little clarity when it comes to future state approaches to K-12 funding and the different education funding bills that we see going through the General Assembly currently. So Kevin is going to help us navigate that. And Kevin, I'm going to let you introduce yourself and talk about your experience and what you do. So go ahead.
Thanks everyone for the opportunity to talk to you today. I told JP this, and I'll apologize now for minor disruptions. We just got a new puppy, so if you hear anything in the background, I'll apologize now. But it's our 12-week-old puppy that may cause some disruptions today. But my background is in health and physical education. I am the health and physical education program director at Wright State University. Some of you may know me from my work with the health education standards. So I've been the advocacy chair for the Ohio Association of Health, Physical Education, Recreation, and Dance for a while. You might also know me from the HOPE curriculum, which is that K-12 opioid curriculum we developed to support health education. And then also we've done this whole child work and this whole child project that some of you might have seen a presentation along the way about that. But I'm really excited to share Ohio's Whole Child Framework. It's about 2 weeks old, and so I'm excited to share it. And I'm actually going to put a link in the chat box, so folks, if they want to go to the ODE website, they can. So you'll see that link there. So JP, if it's okay, we'll just go ahead and get right into just an overview of what the Whole Child is and a little bit of background. The Whole Child has kind of been around for a while. This whole school, whole community, whole child framework has been around for, I think it's about 8-9 years, depending on when you want to say it came out, maybe 10 in terms of conceptualizing. It grew out of the old coordinated school health model, and coordinated school health sounds really kind of boring and not really exciting. And this whole child piece has really been, whether it's the timing, our readiness in terms of the folks that are doing the work, whether it's education being ready to go, but whatever it may be, the whole child has really resonated with folks. And for me, the whole child resonates quite a bit when we talk about our goal. And our goal moving forward is that students are healthy, safe, engaged, supported, and challenged. And so the goal of the framework is exactly that. And so schools, communities, families, what we really want from our children at the end of the day are those 5 things, that they're healthy, safe, engaged, supported, and challenged. And even when we talk to schools about the return to school and working within the pandemic, our main focus continues, hey, what are we doing to make sure that kids are healthy, safe, engaged, supported, and challenged? And kind of throughout today, we'll give you a chance also to share a little bit about how your work fits into this framework. So again, our main focus are these 5 tenets, and we do a lot of different things to get to this end goal of the 5 tenets: healthy, safe, engaged, supported, and challenged. And what I'm going to do today is just take you through the framework real quick and then give us an opportunity to reflect on how this framework can be useful moving forward. Next slide, JP. So why? I feel like I'm preaching to the choir here in terms of why, but I think there's been a shift in the connectedness between health and education. I can remember the work about 3-4 years ago where we were drawn together by HPIO to have a conversation about the connection between education and health. Health kind of thinks of this whole child approach as the social determinants of health, and education kind of thinks the whole child as this is the work that we do. And so it's been nice that the whole child has been able to bring those 2 forces of education and health together for a common goal. I think the other piece is that schools can't do it all. I think we sometimes try to, but we can't. So the hope moving forward is that we can build partnerships and connections so that we can maximize our resources and align those resources together, that we're all going this, quote, the same direction. I think of it as a highway with multiple lanes. We're all headed to grandma's house, but we might take different routes to get there, or we might take different cars to get there. And so really, if we maximize and align our resources, we can get there a little bit quicker, and we can get there together and safely. We think the other piece moving forward, and again, just yesterday, I saw the email from ODE from Director Chris about supporting educators and staff well-being. We're hoping that we can create a whole school and a whole community where the focus is on health and well-being, and taking care of ourselves and our needs to make sure that we're healthy and ready to support others. And I think the last point's a really important one also, but it's also somewhat interesting that we're hopefully moving from a crisis-driven approach to more of a strategic approach through a systems change lens to school improvement. And again, part of this work with the whole child piece is to be able to take this idea of the tenets and the whole child framework into a school improvement process. We'd like to think of this as not one more thing, but kind of the thing that helps to align everyone together. And the idea of crisis-driven, I'll share in just a second, but I always say that we're trying to move from a crisis-driven approach, and ever since we started doing whole child, it seems like there's a new crisis that pops up as we go along. I've done this work in the Dayton area, and we were really focused on mental health with our schools, and then all of a sudden, it was a tornado, and then we kind of moved forward from that, and we were planning to be very strategic, and then COVID hit, and now we are in full go crisis mode, but we still think we can be strategic and systems thinking as we move forward. Next slide, JP, unless you have a comment to add in there.
No, I don't have a comment. I did see in the chat that someone said that they are having some audio issues, that they cannot hear anything. If others are having those audio issues, please let me know so we can try to troubleshoot it. But it seems like most people can. So just go on ahead, Kevin.
Okay, let me know if you can't hear. I can switch my audio also. So this slide here, I feel like I'm kind of preaching to the choir here a bit, because we do this work upstream. But again, the public health analogy that we use about the folks that are out fishing, and there's a couple folks that are fishing, and while they're fishing, they're trying to catch fish, but obviously nobody really catches fish when they're fishing. But along the way, they see somebody that's kind of floating down the river and kind of drowning and struggling to survive. And so they hop in, they do their best to pull that person to shore. They save that person, and everybody's happy, and we move forward, and we save somebody. They're fishing again, and about 25, 30 minutes later, somebody else comes down the river, and then throughout the day, there's just all they do. They spend all day just rescuing folks. And eventually they go back upstream, and they're like, what's going on here? And eventually they find out that there's a waterfall upstream. There's no fence, there's no signage, and folks just go to look at the waterfall, and they end up slipping and falling on the mossy rocks, and they end up into the river. And so we use that analogy to kind of talk about the work, and it's a good analogy, number one, because most of our public health folks understand it, but it also ties into the work that we're doing upstream. And so some of the work moving forward with Whole Child, while it's focused on these downstream issues, and many of you do the work within the downstream issues, what we're trying to do is to connect schools, communities, and all of our partners, including our families, together in this upstream work that we can plan how we're going to ensure that kids are healthy, safe, engaged, supported, and challenged. We do that through our programs, and we do that through some of our downstream outcomes. And some of this upstream work that the framework might facilitate doesn't always pay off right away. It might take some time, and it's probably not headline-making events when you develop a strategic plan or you do some of this upstream work in terms of policies and practices. But we're hoping that all this work upstream will pay off downstream down the road. Go ahead, next slide. So what is the whole child focus in Ohio? This magic started, I think, a number of years ago. I can remember myself when I was on the K12 Drug Prevention Task Force for, at the time, with Attorney General DeWine, where we kind of just started talking about how do we make some change and improve schools and improve the health of our kids, families, and communities. And again, it was framed within the opioid crisis, but at the same time, we were thinking about how do we make this difference, and it was really through this whole child approach. At the same time, the Department of Education had started its strategic planning work, and you can see this is the strategic plan that came out in 2019, and at the center of it is the whole child. And as you can see, maybe it might be a little fuzzy for you, but number 7 is meeting the needs of the whole child. So around our one goal in terms of increasing the percentage of high school graduates, but also the graduates that have a self-sustaining vocation, serving in a military branch, post-secondary education. Even though that is kind of our one goal, that's our outcome that folks see as the main outcome of successful citizens, to get there, we need to implement these 10 priority strategies, and one of them happens to be meeting the needs of the whole child. And so that started the process. So this strategic plan then started to move forward some of the work in the advisory groups that have happened within ODE, whether that is the Behavioral Health Advisory Committee. There were some other committees that sprouted out of this strategic planning process. It led to kind of this whole child advisory team that came together. The whole child advisory team has created this whole child framework, and as you can see, it looks very familiar. Those of you that might be familiar with the WISC model, which is the whole school, whole community, whole child, from ASCD and the CDC, that work is really the grounding piece. If you look at Ohio's framework, it looks very, very similar. We've added a couple of components, but you can see it looks pretty much identical. And I want to commend the work of ASCD and CDC, not to say that we stole it from them because they said, go ahead, use it. but it is really great work for us moving forward. So we do have a framework. It came out a couple of weeks ago. There's a nice website. There's also a webinar coming up on November 17th that's going to help share this work also from the Department of Ed. Next slide, JP, if we don't have any questions or comments. So this slide, folks are probably thinking already, and when we start to talk about the work that we're doing with the whole child, folks instantly think of this as, wow, we've got one more thing, another thing. This whole child framework is just one more thing that we have to do. I'm not saying that the whole child framework is the thing, but I'm hoping that folks can see that the 5 tenets of healthy, safe, engaged, supported, and challenged can be a rallying point for all the work that we're doing, because we are doing really great work in the state of Ohio. I'm proud when I share our work with the whole child, and we share it with other states, or we share with ASCD or the CDC. They're like, wow, you folks are really doing a lot now because of our dedicated funds, and Student Wellness and Success has facilitated the work along with the K-12 prevention dollars, and that initiative has really pushed us forward along with our social emotional learning standards. And now we're seeing an increased focus. Again, on Saturday was the Trauma Informed Schools Conference. We're seeing more work around that. All of that work, all 4 of those really big initiatives that are going on in the state, the goal of all of those is to create a healthy, safe, engaged, supported and supported child. And I think schools can do quite a bit if each of our students are healthy, safe, engaged, supported, and challenged. And so I wanted to just share this slide to show you that it's not meant to be one more thing, but it can be a rallying cry around those 5 tenets. And I'm hoping moving forward that we can begin to share our work in a way that's focused on those 5 tenets, because I think they're really important outcomes that we can show in different ways through local control, through local initiatives, and also to meet local needs. There's lots of different routes to get there to those tenets, but it's really important to focus our work in those 5 areas. Next slide, please. So I'm just going to pull apart the framework a bit that we shared from ODE. So I wanted to just start with some key principles, which is at the center. So remember, we already talked about the tenets: healthy, safe, engaged, supported, and challenged. But around those tenets are some key principles: equity, cultural responsiveness, continuous improvement, coordinating policies, processes, and practices. So we feel like those 4 pieces are essential, and they would be cross-cutting across all of the components and across the entire model. It's really difficult to have the whole child or to meet those 5 tenets if we're not focused on equity, cultural responsiveness in our work. And if we don't connect this work to our continuous improvement plans, whether we're a school-based organization or whether we're a community-based organization, we all go through that process, but it would be great if we could anchor that process around those 5 tenets and around the whole child. And again, to really get the work done, we have to coordinate our policies, practices, and processes. And I would also say some programs also go in there, because we have some programs that are going to be cross-cutting across these components. JP, next slide. So again, that white center that you see there was the last slide of coordinating policies, programs, and practices. Most folks, when they look at the whole child framework, they really focus on these components. And Ohio has included a couple of additional components. So right now we have 12 components. The original model had 10. I can tell you that Ohio added a couple of areas, one being social emotional learning, because we do have state standards in social emotional learning. We also added school safety, because we do lots of work around the state in school safety, and so those are a couple of priorities. We also renamed a couple of them just to highlight some of the things, give them an update a bit. So we've got a few things like behavioral health services was updated. We also have staff wellness and self-care, so highlighting that self-care component with staff wellness. School climate and culture, which includes a lot of our work within PBIS. And so real quick, I want to give you an overview of those components. I probably won't talk about all 12 because I think we know where most of them are and what they do. But the color coding of these components, or the organization of them, are pretty important. So if you look at the top where physical education, physical activity, health education, social emotional learning, that shade of blue has to do with healthy behaviors. Those 3 components are really focused on developing the skills to demonstrate healthy behaviors. And you can see the connectedness between health education, physical education, and social emotional learning. So there are some commonalities across them, and the biggest commonality is that we develop healthy behaviors. The next lighter shade of blue, which includes school and child nutrition, health services, and behavioral health services, that's going to be our health services components. Again, nutritional services, health services, whether they'll be well check visits, school-based health centers, and also our behavioral health services. That originally, by the way, in the ASCD model was counseling, social, and behavioral health services. They narrowed that focus down just a little bit in that component, but again, that's the health services component. Continuing around in a clockwise direction, the darker blue there with family engagement and community involvement. You'll see in a second that some of our cross-cutting features are community and family, but there are specific activities that we do to engage families and communities. So the family engagement piece could be some of our parent education nights, or our family fun nights where we're doing physical activity, but family engagement could also be to engage in health services or behavioral health services. So we've got specific activities to keep families engaged, and also community involvement. Community involvement is also not just our school taking advantage of community partnerships or the community serving the school. It's also activities where our schools connect to the community, and we might be building healthy behaviors in the community. We might be creating awareness or kind of creating norms for our health and well-being. Again, that lighter shade of blue that we haven't talked about yet is healthy environment. So that includes school safety initiatives, our physical environment, that could be litter, trash. A big thing with COVID and the pandemic is water and access to hydration. And so we aren't using water fountains anymore. We have hydration stations. School climate and culture, again, how is that different from physical environment? Well, they're related to each other, but school climate and culture is really that PBIS piece of how we are going to interact with each other, but there is a close connection also with our physical environment, our expectations for behavior and responsibility. And again, the last one, staff wellness and self-care. Traditionally, we've always thought of staff wellness as kind of that focus on almost physical well-being, but we've added the self-care piece to try to get folks to move forward, thinking about mental health for our teachers, but also their physical health moving forward. Traditionally, it's been kind of focused on insurance and reducing our insurance rates, and kind of an activity that would be focused on physical health, and we're hoping to expand it to make sure that we're taking care of our staff as we move forward, and staff being beyond just teachers, bus drivers, food service workers, etc. So that's a quick overview of the components, and I'm sure some of you are like, so where are we in this? We're going to do a little bit of a question and answer in just a second, but I can see where your work kind of fits in multiple buckets here, or multiple components as we go along. So again, there is a connectedness between the components, and there are some specific areas that focus on outcomes like healthy behaviors, healthy environment, health services, and community and family engagement. JP, I'll pause for a second. You can go to next slide, or we can take some comments if you have any.
Yeah, I don't see any questions right now, so let's just power through it and get to the interactive section.
Okay. The last piece, again, on the outside of this model is family. Again, we hope that family and community kind of holds us together, because, again, it's a whole school, whole community, whole child approach. So you see family there and community partnerships. And really the questions there are, how can the school support the community, and vice versa? How could the community support schools? There's lots of momentum and initiatives that schools could help to propel a community forward towards some healthy behaviors, and vice versa. The community is there to support the school in their endeavors to create healthy, safe, engaged, supported, and challenged students. And again, the important piece is the role of the family. This kind of falls apart if we don't have the the family support to reinforce behaviors, to engage in services, etc., with the family piece. So again, cross-cutting features that kind of hold the model together for us. Next slide, please. So a couple of questions, and JP mentioned that we'll kind of have a little bit of an interaction session here. As I go back to that slide that kind of pulled the 4 big initiatives together around the tenets: healthy, safe, engaged, supported, and challenged. A question for the group is, what's the connection between the whole child framework and the work we've done in student wellness and success? And a couple of follow-up questions we'll also ask, specifically, how does the K12 initiative build into the whole child framework? What's the connection there? Because it's not explicit. There isn't a component that says student wellness and success or K-12 prevention. Where is it, and how does it fit in, and what's the connectedness? And the last piece is we'll ask, how does the whole child framework impact your advocacy efforts? So be thinking about those, but I think we'll start with question 1 first, if that's okay, JP. How do folks feel about what is the connection between the whole child framework and the student wellness and success initiative or dollars?
Yeah, and feel free to put your answers or questions, clarifying questions, into the chat So we'll give folks, let's just say 1 or 2 minutes. If I don't hear anything, then we'll kind of just have the conversation and see if folks want to chime in then.
Okay.
So we do have one listener who chimed in a bit. She said, I find this interesting because our prevention program incorporates all the other three bubbles into our lessons. And then another person said, we must consider every part of a child's development. So those are the comments that are rolling in right now, just generally about the whole child framework. But when it comes to the student wellness and success, Kevin, were you referring to the budget initiative specifically and how those
Yep.
were laid out? So I believe, if I remember correctly, that the funding for student wellness and success was divvied up between 12 different potential, I don't know if I can call them pockets or pots or initiatives
Yep.
that schools can kind of undergo um, to use that funding. Uh, and from what I can see, it seems like pretty much all of that is incorporated in this framework in one way or another.
It is. If you can go back to the components piece, just I think it's maybe 3 slides back. One more. There you go. So on the components, go forward one more. On the components piece, where we really see that student wellness and success dollars, it was really driven around services, in particular health services and behavioral health services. There were some things that would kind of also join in with social emotional learning and school climate and culture, possibly some physical environment pieces, but really student wellness and success was focused on that service-driven piece, whether that's health services or behavioral health services. We really saw it fitting there. A lot of the work in those 12 pots or those 12 buckets, we saw a lot of work going there in our schools.
Right. So do
And
you
the
want to?
follow-up, sorry, go ahead.
No, go ahead, Kevin. Sorry.
Well, and I think the follow-up question about the K-12 prevention initiative, where does that work fit within those components?
And I can go back to the components so that people have that on their screen. And again, we'll give people 1 or 2 minutes to look at the components up on the screen and consider where the K through 12 fits in, the K through 12 funding initiative fits in within these components. And Kevin, just from a glance, it seems like really, the behavioral health services, the social emotional learning piece, those fit within the K through 12.
They do, and I would say that that is a pretty interesting starting point, along with, I think folks might chime in too, that they see some work that we do within health education, like they see the connection between the two, that there is some, that prevention builds healthy behaviors. And
Right.
so you see some work in there. It's not necessarily health education in the curriculum, but I asked that question to kind of highlight, is there a connection, and does this model help us realize that while we might be working in social emotional learning, we might at the same time also be developing healthy behaviors.
Right. So one of our listeners wrote, it could fit into all of them because each of these components can be upstream as prevention.
Correct. That's the other thing that we hear a lot of. They're like, prevention is this model. And I would agree that there are elements to this. So when we break it out a bit with this kind of WISC model or the whole child framework, we talk about, the tiers that folks use in the multi-tiered systems of support. We can see work being done in all 3 tiers, tier 1, 2, or 3. Obviously, some of the components are really just focused on tier one, like health education and physical education. But in many of these areas, we do the tiers of work also. And so, again, it is interesting that folks have said that, so originally when we had the discussion with OD, they're like, how come there's no component for prevention? And then somebody chimed in, they're like, we do it all. And
Right.
so we play a role in all of it. So it's an interesting discussion back and forth. But yes, we either see people say some of the above and they target specific components, or they're like, we do the whole thing.
Mm-hmm. Mm-hmm.
So
Mm-hmm. And yeah, that's something important to note because, one of the reasons why, I invited you on and I, have had conversations with you over the last couple of weeks, couple of months is because I want prevention folks to know that, within this framework, prevention is there. And, at a glance, you might not see the word prevention outright in some of like the subsections or components, but the framework is prevention pretty much. And I want to make sure that, as this gets implemented and instituted, that prevention folks don't feel lost, that they know that they do have a place in this as a whole. Um, so that's one of the key points that I want to make sure that we hit on.
and I'll wait for question 3, but there's a reason why, when we talk, things kind of clicked right away. And so I'll follow up with question 3 after some other folks have had a chance to chime in. But I think there's also, I think the model does a really great job of bringing us together a bit. So if we can, let's move on to question 3 here about how does it impact your advocacy efforts?
All right, yeah, let's do that. So again, if you have any comments on question 3, how does this framework impact our advocacy efforts? Feel free to put it in the chat or put it in the questions box.
And JP, can I just clarify too that an advocacy here doesn't necessarily mean like state level advocacy where we're working for, budgetary or bills.
Right.
I think even the advocacy piece is for the work at the local level. So
Right,
you could do
right.
either one if you wanted to. So
Right, right. And I do want to thank you for that because sometimes when I mention advocacy, I am specifically talking about the state house, actually most of the time, because that's, the role in which I work in at Prevention Action Alliance. But for this case, when we're talking about this framework, it's advocacy at all levels. And really, when you're looking at the local level, this is probably where a lot of the work can be done. So yeah, you're 100% right on that. Okay, let me see. We do have one person. Give me 1 second. Let me read this. So one of our listeners wrote, for us, using the whole child and SEL components has gotten us into more schools that had previously rejected prevention programming.
and I would agree. That's where I was leading kind of the discussion piece also. I'm hoping through this model that it actually opens doors for folks because we understand that we're all going the same direction with healthy, safe, engaged, supported, and challenged. And it can kind of be a call for everybody to focus on that main goal of healthy, safe, engaged, supported, and challenged. And it may open doors.
Right.
I'm also hoping that it opens doors to developing relationships and collaboration. That we can see connectedness between components and also kind of this whole school approach, that it might not be one subject area or one program. How do we kind of fit together?
Right. Right. No, that is really great to hear. Because I can definitely see scenarios where because of this shift in language and this new framework, previous coalitions or programs that schools have been hesitant to implement, now they accept them with open arms because they understand it through this way. So it benefits both parties 100%. So let's see. So it looks like we're actually at time. It's a quick 30 minutes, Kevin. So I apologize on that. But before we conclude, I did want to go back a bit and highlight these key principles, especially at this point in time. I feel like I know the Department of Mental Health and Addiction Services, I know Prevention Action Alliance, and really other departments throughout the state. There's a renewed focus on equity and cultural responsiveness. All of that when it comes to cultural humility, cultural competency. There's a renewed focus on that, and I really love to see that this is kind of the thing, within the framework that supports all those other components. and it's, you know, when I look at this, I think of other aspects of the prevention field, like our UMADOPS, which, you know, operate predominantly within our urban communities, and how this really captures the work that they do as well. And as a field, I know we're trying to do a better job of connecting with them and making sure that all of prevention is represented when we make ask and when we try to implement these programs into schools. And I think this does a great job of linking that. So I just wanted to highlight that for folks and kind of applaud that is within the framework.
I'll applaud the department too. They've done a great job. There's a great section written in once you go to the website and see some of the materials. They've done a great job, and I think the whole child could be a kickoff to some of that additional work in equity and cultural responsiveness. So
Right.
I appreciate the department and many other departments moving forward.
Awesome. So yeah, we are at time. So Kevin, once again, I would like to thank you for joining us this morning. This is not going to be a one and done conversation. This is going to be a continued conversation, and I hope to have you on in the future as this continues to move forward. I'm not sure whether you want to put your email in the chat, Kevin, if folks have specific questions for you, or folks can contact me and I can get to Kevin for you. This webinar is recorded and will be on YouTube. So if you want to watch this back, take some more notes, feel free to do that. It is on our YouTube page, the Prevention Action Alliance YouTube page. I did see that Kevin put his email in the chat. I appreciate everyone who participated. I appreciate folks who tuned in. I know that the ADAPO conference is currently going on, which is, you know, a big thing for prevention folks throughout the state. But I appreciate you guys tuning in this morning to have this conversation about this wonderful framework that hopefully will lead to increased partnerships at the local level and really throughout the state. So thank you. Alrighty, and we'll see you guys next time. Thanks.
Thank you.